vitamin D. We don't get the B vitamins we need, omega-3s, zinc. Glutathione is a really powerful antioxidant. So a lot of these can cause hair loss as well. When you're deficient in these vitamins, can cause skin issues and hair changes. So one of the nutrient deficiencies, vitamin D, is something that I always say get tested because we tend to be really, really on the low end, especially living in Canada, because, you know, we have winter like 7 months of the year. So, you know, we don't really go out, get the sun. So when we do have the summer and summer months, please go outside, get as much sun as you can, obviously safely, because you get that vitamin D. It's produced on the skin. You can of course supplement it as well. But you know, if your digestion isn't working well, you might not be getting it all in. So being more active outdoors is really important. And these are some of the signs that you might need more vitamin D, you know? This can be things like you're just more increased sensitivity to pain, or you have more, you're more sensitive to anxiety and depression. You have more hair loss. That's another sign of low vitamin D as well. High blood pressure, increased risk of fractures, you know, and even poor sleep quality. Muscle weakness can also be from low vitamin D, and frequent illnesses, because vitamin D really helps boost your immune system for it to work well. So these are some signs. If you are experiencing these, don't ignore them. Get tested. That way you can figure out what are you deficient in. And speaking of that, B vitamins are another big energy vitamin. It's also really good for boosting your energy, detoxing. It's used up in your liver a lot too for detoxes, and it can help with your fatigue levels, any headaches. It can be really good for boosting your memory, reducing your pain. And there's a lot of things that can deplete your B vitamins because they're so used with so many things in the body. So things like smoking, using antacids. Especially that's important for B12 because you need stomach acid to help us digest and absorb B12. So if you're using a lot of antacids for heartburn, you know, we got to figure out what's causing that heartburn in the first place, so that way you're not depending on antacids as much, and because it can lead to a lot of these deficiencies. So when I think about omega-3s, you know, we always hear.
I'm just going to go right back just one more, because Dr. Udani, go back one slide there. That vitamin B, birth control pills, just super important, because that does affect many families, many women. Alcohol usage. So just if those are two areas that are affecting you, then definitely get your vitamin B checked with your naturopath.
Absolutely. Thank you for pointing that out, Dr. Justine, because you're right, like so many vitamins and minerals are depleted when you're on birth control. And a lot of us are on it for years, you know, so it can be depleted for so many years. And with alcohol, B vitamins are used to actually help detox alcohol out of our body. So I always say, if you have a night out, when you go to sleep, take some B vitamins, because that can help your liver function better too. So these are all great things to get tested as well. And so when it comes to omega-3s, this is obviously that comes from healthy fats, healthy fish, you know, fatty fish like salmon, mackerel, herring. These are really good anti-inflammatory oils. Okay, so when you think about omega-3s, they're very good for reducing inflammation. Omega-6 are a little bit more, they're like the bad boys, you know, we don't want too much of them. And you can get them from like more of the like soybean oil, canola oil, more of that vegetable oil have more omega-6 versus just fatty fish, and sometimes in olive oil, like the nuts and seeds have more omega-3s, and they're better. So why is this important? Obviously, we want more of these healthy fats because they help with lubricating our joints, reducing joint pain, overall risk of heart disease, cancers, and diabetes, things like that. But they also actually help with our cell membrane. So when I think of a cell membrane, I think of, like, imagine a cell is like your house, and the cell membrane is the brick that covers the outside. So we want the good bricks. So that's the omega-3s. Instead of the bad ones that are like crumbling all the time. So that's omega-6s. So the more of the good bricks you have, the stronger the house is, and more able it is to withstand stresses. Okay. So always think like something like that when are you thinking about having more omega-3s in your diet, because that can really help with reducing that aging. So one of the other nutrients that can be deficient when you're older, when you're getting older, is zinc. So what are some symptoms of zinc deficiency? This is when you see those spots in your fingernails, those white spots, that could be a sign that you're low on zinc. Low energy, trouble with even tasting. So if you feel like your taste is off, that could be a zinc deficiency issue. Skin rashes, eczema, trouble with sleeping, even fertility. So infertility can be caused because of low nutrients overall, and zinc is one of these as well. Sometimes, and zinc is really important for immune function. So especially if you have sinus issues, you're constantly sick and you're wondering what's going on, there could be a zinc deficiency happening. And zinc can actually be tested through blood to figure out, do you need a supplement or not? And I always recommend it's okay to do a good zinc in the fall, because that's the flu season, just so that you're protected from all of these infections and things like that. And you can always get more zinc from lots of seafood and avocado, pumpkin seeds. If you're a vegetarian, pumpkin seeds are a great source of zinc as well, and almonds as well.
Overall, it's reducing sugar, reduce inflammation. Look at our intermittent fasting wellness talks and our ways to reduce stress and improve your overall sleep. We know we got to move. We know we have to move. And that will help with aging. It'll help get your muscles strong, your bones strong, and help us with our overall stress management. And of course, it helps with weight management as well. As Dr. Udani pointed out, you need good gut health in order to age gracefully. So this is something that is, not just about going to the bathroom frequently, but making sure that we don't have signs of infection, don't have signs of challenges with our gut flora, because the gut can really be the key to all other aspects of health and other areas of potential disease. We want to open up those detox pathways, and definitely don't do this on your own. You have high risk of side effects and reactions. Many detox products are not regulated, so highly recommend having a coach along doing a detox. I think detoxes can be wonderful, especially annually or as the seasons change. However, do it in a supportive way. We do want to reduce those toxins and the EMF challenge. So just time away from your phone, time away from your Fitbit or your fancy watch, making sure you don't have the phone by your bed when you're sleeping, or your, fancy phone on your watch. Your fancy watch while you're sleeping to monitor your sleep habits. Often that actually prevents you from getting a good night's sleep because of these EMFs. So not something we want to do regularly. We want to make sure that we're not powering up all of our devices near our head. So clearly it would be best in a separate room, and definitely not using a phone. I literally had a patient using the phone under their pillow to wake them up. Not a good idea, because then you have those EMFs going through your brain nonstop. So looking towards some of our other wellness talks on these topics in order to get the best results. Dr. Udani talked about improving your vitamin D, your essential oils. Glutathione is something that we have in our own fridge. But you can get glutathione, which is amazing for your overall body to help with energy. A great support system. So you want to look, you can get it from natural foods. Look at this: asparagus, broccoli, avocado, spinach, tomatoes, garlic, Brussels sprouts, tomatoes, cucumbers, cabbage, walnut, and almond sulfagus. So pick three and add more of those each week. Pick three. So that you can say, okay, that's going to be my go-to. That's in my fridge on a regular basis. If you look at glutathione, it helps your liver. It helps your how growth of new cells. It helps with oxidative stress. It reduces your risk of chronic disease. So looking at how you can get that naturally from food would be best. And then talking to a naturopath about whether you need a supplement or not.